Good day to everyone. Welcome to Dental Shots. Today's video is on bleaching of discolored teeth. So why there is a discolored teeth? It's due to either from the pulpal necrosis, the tooth is non-vital, or it may be due to the intrapulpal hemorrhage due to trauma, and also it is due to calcific metamorphosis. It is like the tertiary dentin is being deposited. The tertiary dentin is going on being deposited. The greater level of tertiary dentin also causes the discolored teeth. Okay, and due to aging, when the person is having a high fluoride exposure due to fluorosis, and also due to some systemic drugs which has been taken during the development of teeth, and defects in the tooth formation, okay, that may also cause discolored teeth. And due to blood dyscrasias and any obturating material which is being like zinc oxide, plastics, and metallic components of the sealers will just go inside the dentinal tubules and causes the discoloration of the teeth. So coming to the bleaching, the intracoronal bleaching techniques, okay, either it may be a thermocatalytic or walking bleach. The name itself, it says thermocatalytics. Thermo means heat, so heat will enhance this bleaching. So how it is done? For both the techniques, we are going to place some medication in the pulp chamber region. So place the oxidizing agent. Example would be a superoxole, that is 30% hydrogen peroxide, is being kept in the chambers. Okay, and then you can apply a heat. That's why the name has come as thermocatalytic. Okay, this will lead to bleaching. So complication of this is that the external cervical root resorption will occur because due to the ingress of all these components into the dentinal tubules, which ultimately lead to the inflammation of the PDL and also the necrosis of the cementum, will lead to the external cervical root resorption. Coming to the walking bleach, the medication which is placed in the pulp chamber is the sodium perborate with water, and we have to ask the patient to come after 2 to 6 weeks for the replacement for the second visiting. But here I forgot to say, in the thermocatalytic you need 2 mm of protective barrier which is necessary to be kept. Okay, but here there is no need of protective cement barrier. Okay, so if you like the video, kindly subscribe to the channel. So the next video will be on certain MCQ discussions.